Hi, I'm drkerryann Williams. Welcome back to Black Mental Health Matters. On today's show, I'm going to be speaking with Dr. Monica Blied. She's a licensed clinical psychologist working in sunny California, and she's going to be talking to us today about autism in young adults. So if you're interested in learning more about autism, then keep listening.
Hello, everyone, and welcome back to Black Mental Health Matters. I'm drkerryann Williams. I'm a psychiatrist practicing here in Massachusetts, and this is a show that's all about everything related to mental wellness in the Black community. So at any point during the show, if you have a question or if you have a comment, just give us a call at 617-238-7111. And we're also streaming live on Facebook. So if you want to go to the Facebook live stream, you can go to the page heat981fm.com. So welcome again to the show. And today I have a guest with me, Dr. Monica Blied. She is a psychologist practicing in California. So she is the founder of a wellness center called Faces of Health, a wellness center, and she provides psychological and neurocognitive testing for young adults and teens, particularly for ADHD and for autism. She has co-authored 12 journal articles, 4 book chapters, and over 65 local and national conference presentations. She is a provider of biofeedback. She does EMDR and brain spotting therapy. She's a certified chair yoga instructor and a health coach. And she also is an adjunct professor at Pepperdine University. She is on the medical advisory board for Lupus LA, and she's on the executive committee for the American Psychological Association Division of Women, as well as the California Psychological Association Division of Education and Training. So I want to say welcome to the show, Dr. Monica Blied. So I had muted her briefly earlier. So sorry.
Thank you so much. With that bio, I'm also a mama of 3, and I'm really excited to be here today on the show to talk about autism for young adults, why it gets missed, and also how it shows up in our communities.
Awesome. So I guess maybe we'll start off with, maybe just a little bit of background in the idea that you even do this testing. Why is this important? What is this an important topic? Why do you test for autism, and what is it?
Yeah, so autism is a developmental disorder. So that means that it's something that is apparent in something that affects our brain. And think about it, we think about diverse wiring or different among the brain structures and how the brain is functioning. And it's really a uniqueness in how that individual with autism spectrum disorder sees the world, how they receive the world, and unfortunately how they are received in the world, because a lot of people who are medical or not living with a neurodevelopmental disorder don't really understand what autism is. And unfortunately, there can be some mistreatment or misunderstanding that happens. So when we look at autism, we see a pattern of behaviors that includes stress. So you're really interested in one particular thing or a few particular things, and you know those things very well. Also repetitive behaviors, same things in a certain way or over and over. Also differences in social communication, understanding. And so that is typically the hallmark of when people think of autism. They think of the person who is robotic in social conversations. And unfortunately, that's how it's depicted in the media, but that's autistic person's experience is like. So we'll talk a little bit more about that and other things that come along with it.
Okay. So I want to say your connection is kind of coming in and out a little bit, but we are able to catch most of it.
Okay.
Is autism the kind of thing where it can potentially be missed. So maybe a person doesn't know that the person they're interacting with has autism. They just think, oh, this person's maybe a little bit odd. Or as you mentioned, they kind of ostracize them a little bit, but they don't realize that it's actually autism. Is that possible?
Absolutely. And it goes back to the question that you asked me a couple minutes ago that I missed of why do the testing for autism? Because it can be missed, especially in girls who have a lot of masking behaviors. So they will cover up, compensate for in some way the areas that they are less naturally strong in, not understanding social communication or those types of things. But and why it's missed at an early age here to the boys is girls naturally have more mirroring behaviors, which means you can see another person and mirror what they're doing, mirror their expressions and their emotional reactions and those types of behaviors. And so if you see a girl a young girl who's living with autism and you see them like for the first time in testing, you might be like, this girl is typical. Like she, said hello back to me. She reciprocated. She, looked in my eyes briefly. She's interested in what we were doing. But if you see that girl a second time, you might see that she's doing the exact same thing that she did the first time that she saw you because she's really following a script. It's not something that comes, more fluidly for her, but it's a script that she's following because she has learned these behaviors. Really fascinating, and why so many girls get missed early on.
Wow. So in something like that, you said they kind of like almost like learn social scripts and they learn how to mirror what other people are doing.
Yeah.
So if you just observe them superficially, they're saying a lot of the same things everybody else says, and so you assume that they understand exactly what they're saying, why they're saying it, and they're saying it kind of in the right ways. And that's in a superficial interaction. You might not catch that they're actually maybe doing all of these things.
Or you assume that they understand what you're saying. Get the nuance of the joke that you just told and those kinds of things because they've learned, okay, when the intonation of the voice, goes this way, this is when people laugh. So I will laugh. And not really understanding that. So that's kind of like one aspect, the mirroring and the masking for the differences. But then also we have it where some parents friendly about their children. My son or daughter, they, kind of have these, or idiosyncrasies, like, okay, she cannot wear the socks with the inseam. She cannot wear the, tags, the only eat these 4 foods, and she's like, okay, my baby's just unique in this way. And what a gift that is to the parents, children, as like, okay, that's just little Johnny, or that's, Lakita, or, whatever the child's name is, and not realizing that those little signs include our features of autism spectrum. And if they only have the awareness of that, they can get their child the support they need to help them to really thrive in life.
Wow. So sometimes it's the parents kind of pick things up, but they don't have all the information. And if they get that assessment, then their child can get what they need as early as they need it.
Yes. And the best predictor of positive and like the most beneficial outcome is that early intervention. Number one predictor is getting that early intervention. And interventions can start as early as 12 months. You know, unfortunately, what happens and what the studies show, our African American kids and Latino kids, they normally don't get tested or interventions. And the Caucasian kids with those same signs and symptoms. And it's not just, you know, because the parents get it and they understand, like, okay, I have 4 children, and, you know, Shanika is very, very different. Let's try to get, you know, Shanika some help, like find out what's going on. And then there's a gap or a disparity in the resources. And so that's where our advocacy comes from. That's where, you know, the parents advocating as well and knowing what resources are available to them. Regional center, and that's the name of it, a regional center in their area where they can, you know, really advocate or fight for their kids to get evaluated and start getting support, start getting speech therapy, start getting occupational therapy, whatever else that child needs to be able to hone in on their differences, and then really ways that highlight how remarkable they really are.
Oh, yeah. So they can kind of be performing at their best.
Exactly.
Yeah.
Exactly.
Yeah. Wow. So let's kind of talk a little bit more about the, I guess recap a little bit. There's these social differences with autism. And is it so one of the things we talked about was that they, you know, sometimes, especially girls, they'll do this thing called mirroring, where they've learned over time how to reflect back the emotions and the expressions that other people are doing. So it appears that they're socially connecting, but they're not actually connecting socially. They're just really good at picking up on little changes in voice quality that would indicate, oh, I'm supposed to laugh right here. Or they notice everybody else is laughing, so now they start to laugh too, but they actually don't get the joke.
Right.
So is it that they're having difficulty like reading social cues, or is it just they're having difficulty with sarcasm or with humor? Like what's the social issue going on in autism?
Yes, and yes.
Okay.
So, you know, and keep in mind, you know, it's neurodiversity, but I think of it as like not neurodiversity in itself, although that means autism, but within the autistic community, there's also diversity. There's also differences. So with each person, it'll look a little different. So for some, there will be like not understanding humor, not understanding the nuances of sarcasm and those types of differences in our language and communication. Oftentimes what you'll see is that person, especially when they rise to being a young treatment, they're in the conversation and not really understanding when to topics to bring up next, and can appear like a social anxiety can also be layered on top of that, but it's not so much of a fear of humiliation of you or not knowing what to say. So like, okay, this person is expressing this. How do I respond to that? And let me just kind of completely dispel a myth that is really harmful. So now more about autism spectrum disorder, but a decade ago, even, you know, we didn't. And so it was really harmful how autistic folks are depicted in the media. They're depicted as the robot, okay? Like, you know, very monotone voice, and that can speaking too softly, those differences in expressive language or expressive communication. However, they're not emotionless robots. That was how they were depicted. Oh, this person is a psychopath because they don't understand. Absolutely incorrect.
Right.
In fact, when you meet an autistic person, they feel a lot.
Yeah.
They have so many emotions and so many feelings, but knowing how to express that
Yeah.
and how to respond to the emotional expressiveness of someone else, that's where the stuckness comes. Like, okay, I see this person is emoting, sadness or grief or anger. Like I'm looking and I'm trying to understand what's happening, but I'm not really understanding and I'm feeling stuck. How can I support this person? And then really feeling paralyzed. And that's really painful. It does cause a lot of anxiety for autistic people, and it does cause a lot of depression as well. Like, I want to be here for this person, but I just said the wrong thing again.
Yeah. Yeah. So basically it's a situation where they are experiencing all these emotions. There's a confusion, there's the anxiety about not knowing what to say, but then it's hard for them to express to other people, here's what I'm feeling. So it sounds like they'll need help with expressing that emotion and their thoughts, and also help with learning how to read those things as well. And so that's part of like the kind of, I guess, like the treatment part of things. Yeah.
Yeah. That's part of the support that they would receive is identifying and labeling emotions. I'll tell you, one of my clients that I had last year, she came in for ADHD testing. And keep in mind that there's a very high co-occurrence between autism spectrum disorder and ADHD. For those who have ADHD alone, about 14% also have autism spectrum. But for those whose primary neurodiversity is the autism spectrum, between 30 and 50% also have ADHD. This is why it's really important to get that testing to be able to differentially diagnose, like, struggling with, what are some additional challenges that may be layered onto this, and then how can we support them fully as a whole person? Because each of those people, like, they're brilliant, they're remarkable in so many ways.
Yeah.
But understanding your challenges and knowing how to appropriately manage those, that's the key. So this person that I saw last year, she was 25 and she was brilliant. And I don't use that term lightly. Her IQ was 2 standard deviations above normal, which in statistical terms, kind of breaking that down, means that if 99 other women or 100 women, 25 years old, her age, were to take the same IQ test, she'd be 1%. Brilliant, and super low self-esteem because she didn't really understand, like, okay, I can get good grades, I've always been on honor roll, but like, why am I still struggling in these ways?
Yeah.
And so part of the assessment process is doing a thorough interview. So 2 hours, we're sitting together and I'm getting to know all your background history, starting from your mother's pregnancy, all the way up until now. And what she had told me was, when I was in college, I would go to bars. It's typical, not normal, but typical college girl going to bars. What do you go to bars for? You drink, depends on, whatever. But she would go and study people. She would study what they were saying versus what showed up on their face. So when they would say, like, oh man, yeah, there's one, whatever, that excitement and their nonverbal expression plus their language, okay, this means the person is excited. or, people go to bars because they're, maybe dealing with self-medicated for depression as well. Like, oh, my cat just died, and then I have to put down my dog. And like, okay, so when they furrow their brows and this is happening, that means that. And so she had gone through her whole college. She's actually first career now, struggling with these ADHD symptoms, but not realizing that she was also living with autism spectrum disorder. Nobody would know. I did not know it at first, because the typical things that you see as far as not having reciprocity in communication, I ask you how you're doing and you ask me how I'm doing, that lacking, that wasn't there. In fact, I was like, oh, I need to, during my lunch break, go pick up my baby or whatever. Oh, how old is your baby? That's not something that you would typically see in someone who needed more support with their autism. So it wasn't until that she had learned these scripts for communicating and for understanding. I was like, let's go back. Tell me more about that. Tell me about how things were in childhood. Did you do pretend play? How were you with other kids? Were you always the follower? Were you ever the leader when you were, doing pretend play? Did it always have to follow a particular script? Like, I'm the biologist and you guys are, different. You're a botanist and you're this and you're that. And if you want to play, Dungeons and Dragons, like, no, we're doing this. Because this is part of my, special interest. So it was so freeing for her. She told me, and she was crying, and she made me cry, girl, during the going on for me. Like, I feel so seen. And this was a Black. Now I know the path forward. Girl, tears. She had been missed all these years because her grades didn't slip, because she was but she compensated in all these different ways.
And you said she was a Black girl as well, you said?
Yeah, she's a Black woman. She actually, her parents were from a specific African country. I won't, share too much, client details, but they were also, because of that specific African immigrant culture, not willing to get additional, seeing is there something wrong with my child in her particular culture. There was a lot of stigma against that. So now that she's, old enough to pay for her own assessment, that's what she did.
Wow. So it kind of brings this idea of, I think sometimes in our community, when it comes to children, there's just a sense of, if you're getting good grades, you'll be fine. And this assumption that social development just unfolds naturally for everybody, and like, don't worry about making friends. I've heard people say that sometimes, even of like small children. And I'll kind of point out, looks like little Johnny isn't really, showing a lot of like social wondering about other people, or not showing a lot of reciprocity. And they're like, don't worry about it. Little Johnny doesn't need to make friends. He just needs to make good grades. He just needs to go to school and focus on himself. And so I can see how then, if this young woman is getting great grades and staying out of trouble, then parents are just going to say, she's okay. There's no need to talk to anybody. There's no need for an assessment.
Yeah, but consider the whole person. Life is not just about grades, about, a fancy career and making a lot of money, right? And I think we as professionals and men, very fully. The whole person includes, how is that person doing on an academic level, yes, but then also on a social level, community, spiritual, medical, mental health, the whole person. Because if you have this strength and brilliance in one area and you're struggling in another area, and you're able to recognize that gap, difference between your ability level in your actual how you're showing up in life. This gap is what creates the low self-esteem, what creates suicidal ideation, and so many other things that we don't talk about enough that have to be addressed, because that person is a whole person and deserves all aspects of their lives to have some sort of sense made around it, or at least some support in the areas that they're not as restricted.
Mm-hmm. Wow. So for those of you that are just joining, you're listening to Black Mental Health Matters. I'm Dr. Carryann Williams, and today I'm talking with Dr. Monica Blied about autism in young adults, because we often don't realize what's going on, especially in our community, where we just expect our young people to just develop socially, that they'll just do it automatically. They'll go to school,
Right.
they'll get good grades, and they'll make friends, and it's not something that they're going to have to work too hard on. And so sometimes we take for granted that we may have a child who's doing okay academically and they're staying out of trouble, and they seem to interact okay within their family because they know the members of their family very well. But they're actually maybe struggling with making friends at school and with, kind of being able to interact with people in a way where they can show interest in other people and things like that. And so if you guys have any questions or comments, give us a call at 617-238-7111. That's 617-238-7111. You can also go to the live Facebook stream. We're on Facebook Live on the Facebook page, heat981fm.com. So you can go to that page and watch the live stream and drop a question there if you would like as well. So, Dr. Blied, you mentioned that missing the social piece, that I guess one of the messages for parents is that they do need to actually pay attention to how their children are doing socially. And you mentioned things like low self-esteem and even suicidality and just kind of like negative things that could happen. Can you talk a little bit more about the importance of knowing how your children are doing socially, and the effects of that, like the depression and things like that?
Yeah, I mean, I think that it comes up only in the kids who get bullied, right? Because a lot of bullying policy, whether they follow through with it or not, but that is more apparent for a lot of parents. And they'll be like, oh no, you don't pick on my child, and those kinds of things. But think about, the kids who are getting bullied. Sometimes it is because the child is not interacting in the same ways as the other children, or the child kind of just wants to be, by themselves. They really enjoy nature, and the other kids just want to kick a ball around, and that's not interesting to them, And so I think that if you are paying attention to your children, paying attention to, so what we're talking about is like the teens and young adults. So these who typically are requiring less support. So found ways to mask. They are mirroring. They've found ways to compensate. So I'm not talking about folks who are on a more severe or needing more support. When we think about these teens who don't bring home friends, so teens who they only are interacting with their friends in pre-coordinated activities. So you have your teens in sports, church group, or whatever, like Boy Scouts, Girl Scouts, and that's when they interact with friends, but in no other capacity. Like, hey, come over to my house and let's hang out, or hey, let's go to the movie. That's what you would see in a typical teen, like, hey, I really want to go with my friends to the mall. But if your child doesn't seem interested in that, or they are interested but they're not patient, then I to kind of probe a little further and see what is going on for that teen, and then see if some of the other things that are typical features and characteristics of ASD or autism spectrum disorder were also present. So that includes the so kid only, is interested in video games, but knows an extraordinary amount of extraordinary amount of information about that particular video game. Or that kid had unusual preoccupations. So when client where when the kid was around 2 to 3 years old, or 1 to 3 years old, every time they would push her in a stroller, they had to stop by the fire hydrant. Stop by the fire hydrant, and she had to climb on the fire hydrant and spend the time with the fire hydrant, and they keep going. And the parents were just like, oh, that's just, what they like, not realizing that that's actually a feature of autism spectrum, having unusual preoccupations. Like, I'm really, interested in things that typical people are not interested in. Like, I have to have, a hanger with me every time that I go on vacation, as a young child, because that is kind of like the safety object, or those kinds of things. So typically when you see someone who's gotten to the point of being a teen or being a young adult, and they're still struggling with the social communication, it's oftentimes that they've missed some signs and symptoms that were earlier on in the neurodevelopmental period that parents just kind of passed off as, oh, that's just, Johnny's weakness.
Well, so can people get assessed? So if people are listening now and they're kind of thinking, I wonder if my child needs an assessment, or my young person, maybe they're after their first year of college and we're noticing that they're having issues socially, they're starting to doing well academically, the idea of getting an assessment, where would they even start? I know it might be dependent on state, but where would people even start? Like, did it just go online and Google, or like, did they ask their doctor, their pediatrician, or their primary care?
Yeah, your doctor is a really good place to start. So asking the pediatrician or the primary care, because they may in the area who they know is really at autism evaluations, and especially uniquely autism evaluations for higher functioning. We don't use that word anymore, but girls who have done a really good job at mirroring and masking. So those teens and young adults. You can also go to a website such as autismspeaks.org. Has a lot of information for parents and for autistic individuals themselves of, could I have autism? Like, what are some signs and features? Like Dr. Drkerryann Williams and Dr. said some things, but like, well, what about this? And what about those things? And see if any of those features kind of resonate with you. They can also, if they're in California, of course, they can come to me. But, just getting as much information as you can, and then also consider that assessment, and you have the official diagnosis, that's when the world opens up. Theoretically, you should have, we're talking about disparities in healthcare, but theoretically, you should have the opportunity for access to resources such as occupational therapy. So I'm really struggling with how to do this specific thing in my life. And occupational therapists can say like, okay, well, here's a way to do that. Here's a different way to manage that. Oftentimes, folks with autism also have executive functioning issues. So executive functioning is, we think about like the frontal lobes of our brain, but it's also like throughout our brain structures, and tasks such as emotion regulation and distress tolerance. How big do you blow at a minor offense? How quickly can you kind of self-soothe and calm down your emotions? Those things, most often we think people with executive dysfunction have issues with planning and problem solving and time management. So these are folks who, have a really hard time with remembering their appointments and getting to their appointments on time, or if they did get to it on time, it's because they have a lot of compensatory strategies. So they have timers and alarms, and it's a reminder from, mom or dad or boyfriend, all these things just to be able to kind of keep up in life. And when they have like a big task, like I need to apply for jobs, they almost get into the being paralyzed or not being able to do anything, because the executive functioning system would help you to break that big task into smaller pieces and then manage each of those. Instead, it just feels like so big, I'm overwhelmed, I don't know what to do, so I'm just like, I can't do anything. The fight, flight, or freeze, I'm frozen. So if they get this assessment, they can also have access to executive functioning coaching.
Wow.
Someone that can help with those things. Like, okay, need to apply for jobs. Let's write down a list of everything you need to do. You need to have a cover letter. You need to have a resume. Let's break down having a cover letter. Let's break that down into small tasks and reward you along the way. So we're training the brain, feeding the brain dopamine, that pleasure chemical, that reward chemical that says like, oh yeah, this is a good thing and I'm going to do it next time, instead of I'm going to avoid this.
Wow. So we talked about how it kind of unlocks access to some of these things, because now you have that diagnosis, you have the correct diagnosis. Yeah. You can know what kinds of things to look for, and you can say, oh, you know what? You get these recommendations at the bottom of the assessment says you may benefit from occupational therapist and executive functioning coach, and so you're like, you realize these people exist. And that they can actually be helpful to you. I guess people might want to know, is at this point, when someone's a young adult, are they paying for this out of pocket at this point, or are there still resources to help people to pay for a professional assessment?
Yes and no. Okay. So you can center. So a person can Google regional center near me or regional center autism near me. And for most folks with low income and no income, there may be testing resources available through the regional center to be able to not just get them assessed and diagnosed, but then also get the treatment started at either low cost or no cost. However, a lot of people don't fit into that category. And if they don't, then it is going to be out of pocket, because, it's a whole nother thing with how our U.S. medical system is set up. But in autism, evaluation is not considered medically necessary. So it usually is an out of pocket, and it can range between, $3,000, just under $4,000, up to $10,000 out of pocket, depending on what other things might be going on for that person. If they also have learning differences, or learning disability, or also having ADHD and all those other different comorbidities. Quite an investment of finances, but then also time.
So, but if a person, is worried enough, and they're able to even just save up for that initial assessment, even if that's the only thing, that still be helpful. And then as time goes along, kind of working on the additional assessments. So I know some of the other folks, like the occupational therapists, they do their own assessments as well, and they have their own, kind of payment. But if you have the diagnosis of autism, at least I know for young people, for kids, if they have an official diagnosis of autism done by a neuropsychologist, it can sometimes be helpful from an insurance perspective to say, I have a documented assessment. I'm not sure what it is for adults, but I know that for kids, if they have a documented assessment, it can be really helpful for getting services. Because sometimes I know for me, I sometimes have patients where we're trying to get services and they'll say, can you show me the documentation of what tests were done to show that they have autism? And it's interesting because I thought, well, I thought that autism is like a clinical diagnosis. I can technically diagnose them myself as a psychiatrist. However, if they have that neuropsychologist that does the full assessment, they can get, it does unlock more services and to have the chance that those services can be covered by insurance, depending on the state.
Exactly. And so some of the testing that will be done, so like the gold standard for autism testing is called the ADA, Autism Diagnostic Observation Schedule. And then there's also the EIR, which is the Autism Diagnostic Interview Revised. So it's the was this child and from infancy, especially like around the 4 to 5 years old. And then there's also something called the MIGDAS or the MIGDAS, which is the Montero interview guidelines, which interviews the person. And that is from, child to adolescent to adults. And then they can also have their parent or caregiver or spouse along with them. So that's often used for the young adults and the late teens because it's more sensitive to be able to pick up on the folks who are missed by the ADOS, the folks who are missed by the, playing, different games and toys. And they have learned, this is how I respond, or this is how I, look up, give eye contact, show reciprocity, and those different features. They've learned those things. The MIGDAS will really get down to the root. Okay, well, how are you with having introducing things into your routine? Or how were you with, and fill in the blanks with that. It's fascinating. But you're right that the insurance companies will look for those specific assessment measures. Were they done? And then what were the results of each of those? I just wanted to mention it's not just a neuropsychologist who can provide these assessments, but also a testing psychologist. So the difference is a psychologist who is a neuropsychologist did a 2-year postdoc in neuropsychology, and typically they just do testing, versus a testing psychologist has also had some training of different neuropsychologists, but they are also very strongly clinically trained. So typically a testing psychologist will have some therapy that they provide as well as testing that they provide.
So they kind of offer more services, which is kind of nice. Yeah.
Yeah. My personal bias.
You can keep it, you can keep it like diverse. So you're not just doing one thing. You're not necessarily doing testing all day. If you also want to have the chance to like provide other kinds of clinical services too.
Yes.
And for those of you that maybe missed the beginning, Dr. Blied also is a biofeedback provider. She does EMDR, brain spotting therapy, chair yoga, and she's also a health coach. And so there's kind of such a wide range of things that you do, and I'm so grateful for you. Thank
you.
I wanted to ask about, are there, we have this term, for our listeners, we have this term that we use in clinical work that we call it the differential diagnosis. And really what that is kind of like, what are the other things that could have some similar presentation, but it's not actually, but it's maybe a different diagnosis. So things that could look like autism, but it's actually something else. And so as clinicians, one of the things that we do is we have this list of like the differential diagnosis, and then we use criteria to narrow down, is it autism or is it something else? So I wanted to ask Dr. Blied, like, are there things that would be on your differential diagnosis that you think, oh, maybe it's autism, but maybe it's this other thing?
Yeah. And something that we mentioned earlier was like, is it just social anxiety? Because that shows up with similar features, but then there are differences as well. Social anxiety is not a neurodevelopmental disorder. So you're typically not going to see specific signs and symptoms earlier in childhood. I mean, you may see like separation anxiety and those kinds of things, but you're not going to see the restrictive, repetitive patterns of behaviors and, a lot of executive dysfunction and those types of features. Also, is it trauma? Because sometimes PTSD or the effects of cumulative or chronic trauma, including racial trauma, can present as odd or socially different. And really it's just the trauma needs to be. So it's other things that could come along with it. So is it one of those things? Is it autism, or is it the both and? Is it autism and ADHD and trauma, and depression, anxiety? That's where the differential comes in.
Wow. And then kind of when that person who's trained does the assessment, and you have a sense of, okay, what does this person need? I was thinking about what you said about masking and the social scripts, and I was thinking, I know that for very small children, when they are maybe not very small, but for younger children, when if they get an early diagnosis of autism and they're having trouble with social kind of interactions, I think one of the things that they are also taught is kind of social scripts. Am I wrong about that? Because I don't specialize in like treating kids that have autism, but I feel like social scripts, sometimes when I hear people using scripts, I wonder, were they taught to do that, or did they kind of learn to do that on their own? Is it something that is also taught, like social scripting, for like learning how to just use certain, and I guess I'll say this again for listeners, like scripting is kind of like where you're using learned phrases, learned social phrases that you hear other people using, and it kind of makes you sound like you know what you're talking about. Maybe that's not a good definition, but you can clarify, Dr. Blied.
Right. Yeah, absolutely. It's for children and young adults. That's part of when someone says hello, I say hello back. When someone says, how are you? I say fine, and then say, how are you? And so for, a neurotypical person, that may come more organically, where it's not as organic or natural for someone who is, on the spectrum. And so learning those scripts is so important. Like, my 25-year-old able to teach that to her. But, unfortunately, a lot of people don't have that. And especially when you're talking about in the younger developmental arena, like young kids, like getting those skills can help them to adapt to this world that is set up for neurotypical people. Yet, at least our society in the U.S. Is not yet set up to help neurodiverse people really thrive. That stigma and that bias and those kinds of things. And in addition to getting that social scripting and that kind of support, they may get one-on-one support in the classroom to help them work with their flexibility as far as being able to smoothly go from one task to another. Because rigidity or, routines can be one of the features of that person with autism. Like, okay, no, we were working on science. Like, why are you trying to go to math now? Like, I'm really interested in science. Like, actually, I love science. And so then the emotional dysregulation comes up. And, I just wanted to, disclose that I'm sharing this from a point of view, but then also personally, my 15-year-old stepson lives with ADHD and autism and requires quite a bit of support for his autism spectrum. So just being, kind of in a periphery as stepmom and seeing the support that he's needed and also how he thrives, despite the differences, because getting support from, kindergarten on, it's made such a huge difference.
So for parents out there that might be thinking, I wonder, I notice there's something that's wrong. I wonder about an assessment. They might be feeling fear for different reasons. I guess I want you to answer the question, is there anything to fear with getting an assessment? Is there anything to fear with receiving a diagnosis, either for the person or for their child, of autism? Is there anything to fear?
Well, first, let me state that fear. Like, it can feel really scary something's wrong with my child, I don't know what's wrong with my child. So let me just kind of empathize with parents out there. However, I think the fear comes from the stigma of having a mental health diagnosis. Like, oh no, my child is not typical, but I think once you get over that, and that's your own stuff, mom, that's your own stuff, dad, and realize that like getting this diagnosis is actually going to help your child be all that they can be, kind of, like the Army slogan, but really thrive and step into their full potential. Then you realize like, hey, this is what I need. It's like having some signs and symptoms that I've been getting busy, I'm really tired, like but I don't want to go to the doctor because I'm afraid that I'm going to get diabetes because diabetes runs in my family. Like, okay, you already got diabetes. Let's go and get diagnosis so that you can get the appropriate supported interventions, lifestyle interventions plus medication interventions. You already know your child is autistic, probably because you're also autistic, or you recognize that, your spouse or grandparents or someone in the family, right? That child, imagine that the support that they can get that you didn't get, or uncle or auntie didn't get, and how much further they can go because now they're able to really capitalize on their strengths while managing their challenges. It's a gift. It's a beautiful, beautiful gift. So parents, if you can just deal with your own shit, your your own kind of, reservations for the advocacy of your child or for, your young adult, child, if you're listening, then man, like I said, this child is brilliant. We think about autism from like an evolutionary perspective. And, I'm, not necessarily like, my faith system is different, but just think about like, why would there be people on earth who could narrowly focus on, one or two particular interests and become expert in that naturally? Of all trades, it is a master of these traits. The societal advantage, one who can create Apple in products that we use, including these earbuds in my ear. The genius, develop the first airplane. However, if that individual is being held back by the low self-esteem and the lack of confidence and the depression and anxiety and all that because they don't know what the heck is going on for them, the world misses out from their brilliance.
Yeah. Wow. I mean, that's so true. I think so. I'm glad that you kind of phrase it that way. I think it's going to be very helpful for a lot of parents that they're, getting the assessment, getting the diagnosis can actually be uplifting and lead to greater things and lead to that either for yourself or for your child kind of living their best life. So I want to thank you so much for coming on the show today, Dr. Blied. I know that this is a very, very important topic for us to talk about because we're in our community. So many of us, we have, whether it's us ourselves or our children or other family members that experience autism, and it's like nobody wants to talk about it, and people are kind of have negative things to say or just don't know what to say. And I think it's important for us to bring these topics out in the open and to talk about it and to help one another. So thank you so much for coming on the show.
Thank you for having me. And if anyone is interested in learning more about me, you can follow me on Instagram at Dr. Blied, Blied, or go to my website, drblied.com.
Awesome. And thank you for those who joined by Facebook. And thanks for those that have been listening on the radio and also kind of just watching the stream live. You can join me again next week, Sunday, 1 p.m. Eastern Standard Time on heat981fm.com. So if you have any questions throughout the week, you can check me out on Instagram as well, drkerryann, drkerryann. So I will talk with you again next week. Have a good week.
Bye.
Hi, everyone. I hope you enjoyed the show today. For more on Black mental health, go to my website, drkerryann.net. You can also follow me on Instagram at drkerryann. And tune into my show every Sunday at 1 p.m. Eastern Standard Time on 98.1 FM, The Urban Heat. So take care.